All right. Well, happy Friday, everyone. Hope everyone's having an awesome day. All right. So it's been a while since I have popped into the Facebook, well, not Facebook group. It used to be the Facebook group, but then Facebook changed the rules. So I'm live streaming to my Facebook page and my YouTube channel. And I'm here to see if anybody has questions related to thyroid health. Again, it's been a little bit since I've made an appearance here. So if anybody has questions, definitely let me know. I am going to, before answering questions, just for those who are not familiar with other resources that are out there. So I have a podcast. It's called Save My Thyroid, and you could either check it out by visiting savemythyroid.com and clicking on podcast, or you could just visit your favorite podcast platform and just type in Save My Thyroid, and you should find it. And so, as far as the podcast, a little bit more focus on hyperthyroidism. You'll notice that there are, I mean, most of the thyroid related podcasts out there focus more on hypothyroidism. So when I put together this podcast initially, the goal was just to focus really, or mainly maybe like 90% on hyperthyroidism graves. But then, especially when I had the guest experts, most guest experts didn't have a whole lot of knowledge when it comes to hyperthyroidism. There's a few exceptions, but so I did write a book also on Hashimoto's. And I've written a few on hyperthyroidism as well. But you'll notice that there are more specific topics. Like most of the episodes will benefit both people with hyperthyroidism or Hashimoto's, but I'm more likely to do an episode that focuses on hyperthyroidism and Graves rather than one that focuses on Hashimoto's, just because again there are so many other thyroid related podcasts that focus on Hashimoto's and really none that focus on hyperthyroidism. So also my website, naturalendocrinesolutions.com, which has hundreds of articles and blog posts related to thyroid health, thyroid autoimmunity. I also have a supplement line, which you could check out by visiting thyrosave.com. And then I have a few books. So my first book was released in 2011, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. I just released the third edition. Hard to believe it's been almost a year. It was October of 2023, and it's right now late September of 2024. So that's my first book related to thyroid health. And then in 2018, I released a book called Hashimoto's Triggers. And then just this year, I released a new book on hyperthyroidism called The Hyperthyroid Healing Diet. I've been working on that book for a while, and then I just decided I was like, you know what? Before releasing that book, I really need to update the natural treatment solutions for hyperthyroidism and Graves' disease, because I released it in 2011, and then the second edition came out in 2013. So it was 10 years since it was updated, and some of it wouldn't align with the hyperthyroid healing diet book. So I was like, all right, I really need to update that. So I took a break from writing the hyperthyroid healing diet, and then created the third edition, also created the audio book for that. And then it came out in 2004 with the hyperthyroid healing diet and the audio book, which I self-recorded both of those. So definitely was a pretty busy time late last year and first, I'd say 3-4 months of this year. And that is it. So if there are questions, definitely let me know. And and there might not be as many questions as usual because I forgot to send, like usually I send an email also besides just posting it. I'll send when I post it, that when I make the announcement, it automatically posts on the page and the YouTube channel. And then I also post it in my 2 Facebook groups, which have a good number of people. But then I usually send an email, and I forgot to send an email. So we'll see how many questions we have. We again might not have as many, but and then also it was a short notice. I wasn't, as of yesterday, I wasn't sure if I was going to do this, but I was this morning. I realized I was able to. So anyway, we have Sarah with a question. Sarah says, "Hi, thanks for doing this live for questions, and you are welcome. So I've had thyroid troubles for a few months now. My thyroid was hyper on August 6th of 2024. My lab work shows no antibodies, but very high thyroglobulin. On 9 on so September 1st, 2024, I lost my voice completely. I've not been able to speak since. It also is difficult to swallow. Many other symptoms also, waiting for more testing to come through. What else should I be asking for or preparing myself? Thanks again." So you said your thyroid was hyper and no antibodies, but very high thyroglobulin. So I guess a few things. So you said no antibodies. Which antibodies were tested? Was it just the Graves antibodies? I mean, there's three main types of antibodies. There's TPO or thyroid peroxidase antibodies. So I'm guessing they tested that. And then there's TSI or thyroid stimulating immunoglobulins. Those are more closely associated with Graves. And then there's thyroglobulin antibodies. There's also thyroglobulin. So I'm thinking maybe they tested thyroglobulin antibodies and thyroglobulin. Again, if you could clarify in the comments if they did test for both, and let's say was thyroglobulin antibodies negative and thyroglobulin positive. Um, so yeah, so if you could let me know which specific antibodies and if they tested for both thyroglobulin antibodies and thyroglobulin, or if they just tested for thyroglobulin. And then yeah, I'm sorry, so sorry you lost your voice. I mean, I'm thinking you got an ultrasound, but if not, definitely would recommend a thyroid ultrasound. I mean, I'm sure you got like the testing that I like the basic tests, like a complete blood count with differential, comprehensive metabolic panel, lipid panel, all that. I mean, the concern with not thyroglobulin antibodies, thyroglobulin elevated. I mean, it could be a few different factors. Having elevated thyroglobulin antibodies is a common cause of elevated thyroglobulin. Sometimes it could be an iodine deficiency that causes elevated thyroglobulin. And then a more less likely cause, but still a potential cause, is thyroid cancer when you see thyroglobulin elevated, especially like when it's really high. So if it's like mildly high, probably not. I mean, I've seen cases where it's extremely high and it's not thyroid cancer. So it doesn't mean that it's thyroid cancer. But so, I mean, those typically, I mean, that's what you're really going to want to look into besides the thyroid markers to the thyroid, those other blood tests I mentioned. I mean, I do a comprehensive testing. I do things like vitamin D and B12 and an iron panel. Again, do you need all that in this situation? I mean, I would recommend it anyway, just because that's what I would recommend if you were a patient of mine. And then again, a thyroid ultrasound, which I'd be shocked if they didn't do a thyroid ultrasound. But I mean, difficulty to swallow. I mean, so it sounds like you have some type of goiter. And if you have a goiter, what can cause a goiter? A goiter is a swelling of the thyroid gland. Maybe you have nodules too, but that's what the ultrasound would be for. So with goiter as well as with nodules, so inflammation, and it can be a factor, and a lot of things can cause inflammation. I mean, as far as blood testing for inflammation, they could do a CRP, HSCRP, which is high sensitivity C-reactive protein, which is an inflammatory marker, ESI, which is erythrocyte sedimentation rate. Insulin resistance can be a factor with goiters as well as nodules. So looking at hemoglobin A1C, fasting insulin, if they do a comprehensive metabolic panel, which they probably already did, they would look at fasting glucose. Problems with estrogen metabolism sometimes could be an issue, which you can't really look at in the blood. That would be dried urine testing, something like the Dutch test. And I mean, iodine definitely could it's very, very controversial. So it can cause a goiter, an iodine deficiency. Sometimes it could worsen a goiter or thyroid nodules, but maybe consider doing a urinary iodine test. Blood testing for iodine not too accurate. And yeah, I guess that's pretty much my feedback. So if there's any follow up questions, or again, if you want to let me know which antibodies were tested for, if they did an ultrasound, and if so, what did they find? And if anybody else has questions, let me know. Again, yeah, whenever I have these, especially when it's been a little bit, it's been about a month since I did this, or yeah, a little bit over a month maybe. Usually there's 45 minutes, an hour worth of questions, but like I said, I forgot to send the email out. Usually I'll send an email out letting people know. So, because the problem with posting it, in my Facebook groups combined, I have like 25,000 members, but only maybe 1%, if that, would see so I mean, that'd be a few hundred people that see it. So 1% of 25,000 is 250. So, and it might be more than that. It might be like 500, but again, not a lot of people see it when it's posted. And those on YouTube, I got about 6,700 subscribers. So I don't know. I think everybody should be alerted to that, but it depends if they're checking YouTube. Same thing if they're not in the Facebook group. And I do the post. But anyway, so far there's no other questions. I mean, if there's no other questions within the next couple of minutes, I'll just call it a day. I don't mind doing a quick Q&A, and I don't, next week I won't be able to do one. I might be able in a couple of weeks. It's just also I do a lot of interviews for the podcast and all that. So that's the challenge. I, I try to do it at the same time, but I can't be consistent with the same time unless I just stop doing what I do. So, um, yeah, but let me take a quick sip of water. All right. Well, again, if there are no follow-up questions or no new questions, then I'm fine. Like I said, just call it a day, and just making sure everything. Yeah. Let me just double check. Just kind of odd that, but like I said, probably because I didn't send the email. So let me just make sure on YouTube there's nothing showing. Like sometimes people will post it, and I mean, it should show here. All right, trying to check out YouTube. Let's see. Yeah, it's definitely live streaming to YouTube. Let's see. So Anna, iodine deficiency. Should we supplement? It's a good question. I mean, my approach now is definitely different than years ago. I think any deficiency eventually should be corrected, but I've just seen a lot of problems with iodine supplementation. Like I think it's fine if someone takes a multivitamin and has iodine, or eating some food sources of iodine, as long as it's not extremely high, like kelp, for example. And again, some people do fine with higher dose iodine foods and even supplements, but not everybody does. So I usually will work on other areas, correcting other imbalances, uh, j- other than just having the person eat some foods that, like iodine rich foods. I mean, one want to make sure they're getting some iodine, because especially with Graves, hyperthyroidism, but even with Hashimoto's, a lot of doctors will say like completely avoid iodine or just very, very, very low iodine. And again, I'm not suggesting higher amounts of iodine, but if someone has an iodine deficiency, usually I'll put on the back burner and address other imbalances, other triggers, do things to heal the gut, and then eventually do things and to address the iodine deficiency. And it might involve separate iodine supplementation, but usually it's not going to involve massive amounts of iodine. All right, just gonna check Facebook, like check my groups. Let's see if I can. Oh, there we go. So let me just make sure nobody posted a question under the post. In the meantime, if there's any other questions, definitely let me know. You are very welcome. Okay, so nobody under my group Graves' disease and Hashimoto's. Nobody posted any questions. All right. Okay, if there's no questions, there's definitely people watching, but if there's no other questions. Again, I'll just make a note next time. Don't forget to send the email reminder, especially when I do this on short notice. Usually, I'll try to give like 24 hours notice, but like I said, I wasn't sure if I'd be able to do it today, so I just gave a notice this morning and didn't send an email, which is probably why I didn't get as many questions as I usually do, but anyway, I'm just trying to check. I was able to check one Facebook group and just my computer for whatever reason. Hold on, just also plus I feel bad like signing up because again I did make an announcement, but if there's no questions, there's no questions. Feel bad if like someone comes late, but if they come late, they come late. Let's see. Oh, someone did comments in one of the Facebook, just comments. Appreciate you and all the information, knowledge you share with us. Thank you for doing this. I'll just heart that comments, but all right. Yeah, it's fine if you just. I mean, if you have a question, let me know. We haven't had a lot of questions. I just, again, usually I give more notice that I'm going to do one of these and then I send an email and I only gave a few hours notice and forgot to send out the email. So I have no symptoms and first endocrinologist appointment on Wednesday. Uh, so can I ask if you have no symptoms that I assume they found something on the thyroid? Did you go to like your primary care doctor? They did blood testing and then, so that's, I see you have a follow-up question. Is there a reason I need to do meds if I don't have symptoms? Um, I guess maybe if your thyroid hormone levels, again, I don't know what your, I assume you went to a primary, they did some type of thyroid test and that showed something, blood work on regular visits. So I don't know if they just did a TSH. I mean, if you have hyperthyroidism, every now and then there'll be someone who has elevated thyroid hormone levels and elevated thyroid hormone levels, but they won't have symptoms. Now, the concern is that it could still affect bone density. Maybe it's not affecting the heart, like so maybe your heart rate's not being affected. Now, again, there are natural options such as Bugle Weed, which is what I took when I dealt with Graves. So it really depends on the situation, but so not everybody needs to take the medication. My thyroid peroxidase antibodies are 43, which wasn't, I mean, depending on the lab, some like have it less than 9, which 43 is not crazy high, but still would be out of range. All right, Catherine, hello. If you have a question, let me know. I was close to signing off just because there were no questions, but again, I did this to answer questions. So Catherine says, what causes a shift from hyperthyroidism to hypothyroidism with continued treatment, even after stabilized ratings? I mean, the two most common reasons for shifting from hyper to hypo, one is subacute thyroiditis, which is not autoimmune. It's when someone, it's typically caused by a virus and causes hyperthyroidism, but it's usually transient, a few weeks, a few months, and then someone makes a switch to hypothyroidism. Another reason is having the antibodies for both Graves and Hashimoto's. So someone, if they have both the antibodies, might start off as hyper, and then over time develop hypothyroidism. And there's also hashitoxicosis. Hashitoxicosis is the third reason, which is when someone has just the antibodies for Hashimoto's, but that sometimes could also cause transient hyperthyroidism and then eventually hypothyroidism, low thyroid symptoms or low thyroid presentation on a blood test. So hope that answers your question, Catherine. If there's any others, let me know. Oh, I missed that. So bone density is fine, heart rate is fine. I mean, that's good if heart rate is fine. Assume they did a bone density test. I mean, if bone density is fine, heart rate is fine. Like, if you're sure bone density is fine, heart rate is fine. Again, I can't tell you not to take the meds, um, but again, like, yeah, if everything's fine, like symptom wise, then I mean, again, if thyroid hormone levels are elevated, it can affect bone density over time. And again, I don't know if that's the case with you. I'm just saying, even if they're fine now, maybe you don't need the medication, but like I said, there are other options besides the medication. I again, I did not take the medication when I dealt with Graves, so I'm definitely not pushing medication, but I did something to lower the thyroid hormone levels. Again, I definitely did feel symptoms. I had an elevated heart rate, which you don't. But like I said, even if your bones are healthy now, and if your thyroid hormone levels are elevated, if they're not elevated, like if your TSH was just low or high, if you like, so if your TSH is out of range, but your thyroid hormone levels are looking pretty good, then maybe you don't need to take anything. Okay, Catherine, in that case, what are the best herbs or diet to be incorporated? I mean, it depends on I mean, so if the cause is autoimmune, then I typically, I mean, again, there's not just like herbs that I randomly recommend. I do, like, diet wise, I could say I usually recommend an autoimmune protocol, like an AIP type diet, for my autoimmune patients. But herbs really depend. I mean, if someone has, again, you have hyper to hypo, so there's really not herbs that I would say. I mean, it's really based on testing. I would recommend like adrenal testing to my patients, and it depends on the health history. Sometimes gut testing. I mean, I do give some general recommendations like a fish oil, a probiotic, but as far as just like recommending herbs, it yeah, there's not enough information. That's to like I don't just randomly just give herbs. If someone has hyperthyroidism, like again, I might recommend Bugle Weed to lower the thyroid hormone levels, but you right now have hypothyroidism. Okay, and Lisa, I don't know if it's Lisa, as Lisa, if it's pronounced Lisa, just unique spelling. But anyway, you work out with weights, gluten, sugar free. Awesome. Yeah, that's great. That's yeah, I would keep that up. I do the same thing. I work out with weights. I pretty much avoid gluten. Yeah, I have a sweet tooth. I can't say 100% avoid the sugar, but I'm pretty good. Yeah, definitely know the concerns with the refined sugars and something that's an issue with a lot of people. So yeah, definitely keep that up. And I will say back to this question, I do. I mean, my recent book, The Hyperthyroid Healing Diet, goes into really good, great detail. Again, it's more for hyperthyroidism, but even if someone has Hashimotoxicosis, like an autoimmune component, again, I talk about kind of a modified AIP diet. But there's also a lot of free information. Obviously, if you're following like an autoimmune protocol, yeah, there's Sarah Ballantyne, paleomom.com. It's a good resource. So that's thanks. Very helpful. Uh, you are welcome. Thanks for the question. All right. Any other questions? I'm glad we made it at least or close to half hour. Not that this hasn't happened before. It's happened numerous times where I thought we would not have questions, and then we had, even though here it's from just a couple of people. But let's see. So maybe I just fight the symptoms. My GP has called every week to be sure I feel okay as I wait for the endocrine. How much bugle weed? I don't know. Like again, I'm not even saying you need bugle weed. Like bugle weed, if someone has elevated thyroid hormone levels, it differs. Just like the medication, like it's not just like a single dose. I'll say when I dealt with Graves, I took a teaspoon, which is 5 milliliters or 1 teaspoon twice per day of the Medi herb bugleweed, which is a 1 to 2 extract. Some people will take herb farm bugleweed, which is less potent, so they might need more than that. But it also depends on the thyroid hormones. If your thyroid hormones aren't elevated and just your TSH is low, you might not need bugleweed. So that's why I was kind of trying to see like what your well, like what I don't know if you know your numbers like TSH, free T3, free T4. If they tested those, they might not have even tested that. And you might just sometimes they'll just test TSH, sometimes they'll just test TSH and free T4. But yeah, as far as fighting the symptoms, yeah, I mean, it's so I got the impression that because I thought you said initially you didn't have symptoms. Yeah, you put first I have no symptoms and first endocrinologist on Wednesday. So I'm not sure what symptoms, but if you're having, I mean, cardiovascular symptoms, like I took motherwort too, which was also I took from Medi herb when I was dealt with Graves to help with the heart palpitations. Okay, cool. So TSH is 0.01, 5 for the free T3, and T4 1.7. So if you're in the United States, then T4 is just maybe a little bit high. Depends on some labs might consider it within range, but most would consider it mildly high. And free T3 would be a little bit high. Like optimal, I would say, again, there's different ranges, and if someone's international, that's completely different. But typically, United States, like the optimal range for TSH would be between 1 and 2. For a free T4 would be between 1 and 1.5, and for free T3 would be between like 3 and 3.5. So it's not too bad. And maybe you don't have symptoms because of lifestyle. Yeah, could be. Also, like I said, it's kind of mild too, mildly high, the symptoms. So yeah. So like I said, I can't specifically say this is how much bugle weed you should take because everybody's different, but maybe you don't need as much. Like I said, my levels were definitely worse, and I took a teaspoon twice per day. If a patient of mine levels look like this, and if they're not symptomatic, I might have them take like half a teaspoon, maybe once a day, or maybe twice a day of the bugle weed, and then see how they feel. But again, if they're not feeling bad, then the only way to know is to put them on the bugle weed and maybe do another blood test in 4 to 6 weeks and see if there's any improvement. Thank you so much. My doc calling made me nervous. Yeah, yeah, they tend to do that. You're welcome. So, yeah, good luck with your appointments. Again, I mean, when you go to the endocrinologist, I'm sure I don't know for sure, but you figure they would do antibodies to make sure it's not Graves. Maybe do an ultrasound. So I'm sure you'll find more information. And just remember, I mean, here on the slide, you can see I do have 2 books, but then there's also free information I have. So depending on what your diagnosis is, podcast, savemythyroid.com, naturalendocrinesolutions.com. So yeah, hopefully it's negative for Graves and the ultrasound looks good, but depending on what they find, like I said, there's a lot of resources. All right, I've got them. Cool, cool, cool. All right, well, thank you. Well, thanks for your support. Thanks for your questions. Um, And again, I don't know when I'll like again. I'll be out of town next week. If I do it in a couple of weeks, feel free to pop in and let me know like what they found. But like I said, hopefully, fingers crossed that uh, that it doesn't show Graves. And I mean, if it does, it's not the end of the world. I mean, just so prepare you. Most endocrinologists are not all of them, but many of them are negative. Many of them are going to say radioactive iodine or surgery is the best option. Now, again, with your numbers being as mild as they are, I think would be crazy to like for them to suggest that. But again, they might, depending on the endocrinologist, some are more aggressive than others. So if you talk about diet, lifestyle, many won't be on board and they'll say, oh, that's not going to make a difference. Again, if they don't say that and if they're more optimistic, that's great. But I'm just preparing you in case you have a typical endocrinologist who is negative and doesn't think diet and lifestyle will help and gets aggressive with the treatments. I mean, chances are with those numbers, they are probably going to if you, depending on what the results, if you do get diagnosed with Graves, they probably will recommend antithyroid medication based on just you're being hyper, even though it's on the mild side. Now, they might say take a lower dose of antithyroid medication, but like I said, just preparing you. It's um, just hopefully it's not a negative experience, but many times it is. Just the endocrinologist. I don't know. It's rare to find one that's just has a positive outlook when it comes to incorporating diet and lifestyle. And yeah. So anyway, just like I said, hopefully I'm completely wrong in your situation and you have an awesome endocrinologist and everything goes well. But just in case you don't, I just don't want you to go out of there being discouraged. I'd rather you think a little bit negative going in there and being pleasantly surprised that the endocrinologist was positive rather than just going in there nervous and then the endocrinologist makes you even more nervous. And so and thanks for doing this. My mom had Graves or has had Graves for 20 years. She's 89, is doing great, but did have the radioactive iodine and on a lot of meds, has TED too. Yeah, keep in mind the TED, thyroid eye disease, the radioactive iodine can cause that in some cases. Again, usually they won't give radioactive iodine if they know the person has thyroid eye disease, but sometimes it'll be hidden. It might be a very mild case where you don't even notice it. And that's happened where someone, I mean, definitely more than once, where someone took the radioactive iodine and their eyes were fine until after they took the radioactive iodine. Now, again, that might not have described your mom, but just, or maybe it developed years after getting a reactive iodine. But the problem with the RAI, as you know, it doesn't do anything to address the cause of the problem. So, but it's great that she's at 89 years old is still doing great. Um, even though on a lot of medications, but it is what it is. So, okay, it did. So it did cause the radioactive iodine. It did cause the TED. So, yeah. Anyway, I mean, learn from your mom's experience. Again, I'm not a big fan. I won't say there's a time and place for TED. I mean, for RAI, radioactive iodine. I think there's a time and place for surgery in some like extreme cases. I'm not saying in most cases, but radioactive iodine, yeah, I'm not definitely not a big fan. Not a big fan of surgery either, but if I had to choose, if I was in a situation where I had to choose one or the other, I'm pretty sure I would choose surgery and not radioactive iodine. Again, not wouldn't want surgery either, but just if I absolutely had to choose one. So, but again, I'm glad. I mean, a lot of not everybody who gets the radioactive iodine does bad. I mean, I've heard a lot of nightmare stories. I'm glad your mom's, other than the thyroid eye disease, otherwise, I'm glad she's doing well. So thanks for sharing that. Thanks for your questions and sharing your numbers and all that. And like I said, hopefully all goes well with your appointment on Wednesday. If not, if it doesn't go well, you're not going to get results on Wednesday. It's just going to be because your endocrinologist is negative. So when I say hopefully goes well, hopefully you have a one of the better endocrinologists that's out there. So all right. Well, it was a pleasure. I'm glad we again glad I went at least 30 minutes. I thought at first I might only go like 10 minutes, but like I said, sometimes that happens and my bad, my fault for not sending out an email ahead of time to remind people or and again to also post this on short notice. I usually try to give more time but this has been so helpful and comforting. Hope you do this in a couple weeks, and I'll keep you posted. Yeah, I think I'll be available. I got to see. The question is, do I have a podcast interview or something like that going on in a couple weeks? Which there is that possibility. If could also do it at a different time too. I'd try. My goal was to try to do these like once or twice a week and be consistent with, or once or twice per month on a Friday, be consistent with the time, but just I always have these interviews, so I might have no choice but to just like fluctuate the times and just give people more notice. But anyway, yeah. So hopefully, maybe I'll catch you in a couple of weeks. Again, best of luck with your appointment on Wednesday, and I hope everybody has a great rest of their Friday, a great weekend ahead, and happy fall because I think tomorrow is the first day of fall. So, so have a great last day of summer too. All right, take care, everyone.